Hello, everybody. I'm happy to be back with a distinguished person. She's a doctor and she's also done healthcare management, and now she's doing a PhD related to diabetes, a very important issue since diabetes is exploding, not only in India, but around the world. So I'm really very happy. Let's listen to her. We have with us Dr. Manisha Aeron. Let's listen to her. Over to you, doctor.
So, thank you, Dr. Subodh, for this opportunity. And how I have reached to research on this subject, I would like to share my journey that what events in the healthcare system or what events in my life shaped me to where I am today. So, I would again like to tell myself, Dr. Manisha. I'm an M.B.B.S. MS Ops and Gynae. I have done my MBA Healthcare Management, and currently I'm pursuing my PhD Healthcare Management with IIHMR Delhi. And my current topic of research is self-management of type 2 diabetes in elderly population. So if we go back to 1980s, the education system at that time in my city where I lived in Bikaner, Rajasthan, was such that no, the people or the bright students, they had to opt for science stream, and the commerce and arts was taken by the others. Although if we see today, the education system has not much changed. And even in the schools today, the school authorities push bright students for opting science stream. Although the awareness among the parents and the children have increased, the students have access to career counseling, career fairs, aptitude test, which makes them make more free choices. So, no, as I was assigned science subject and was not assigned the other thing, other subjects like arts and commerce, I slowly started enjoying science, and no, and a few aspects of it started intriguing me. So I started as I was pursuing my BSc. I fell in love, and I got married very early in life into a family of doctors, and in, it was their legacy which and the lineage which has to continue as doctors, the decision of pursuing MBBS came in. And it was during this time I got an opportunity to pursue my MBBS in Russia. It was back then at the time of perestroika. So it was the time when Russia was, or former USSR, I would call it. Former USSR was moving from communist rule to the democratic rule. And so I landed up in a country, the language, whose language I was not knowing, nor anybody spoke English. And no, the country was going through a struggle to become what we recognize today as Russia. But back then, even buying a bottle of milk meant standing in long queues for hours when this transition was happening. So, no, I completed my MBBS and MS from Russia, and I stayed there for 10 years. During this decade, I learned Russian language and fell in love with the Russian food. And they soaked me with everything what they wanted to teach me. So when I landed back in the homeland, I was shocked between the cultural and the professional differences when I started working in one of the government hospitals in Rajasthan. And coming from a place where patients knew about their disease and participated in their treatment plan, to a place where doctors were considered saviors, and patients had no awareness about their disease, and the counseling was not on priority. It was more of a symptomatic treatment. So I got the opportunity to work in government organizations as well as private organizations and NGOs. But I felt that all the organizations had very different vision. The public sector focused more on cost-effective treatment to the larger public, whereas the private organizations they actually provide quality care, but are revenue oriented. So because of this, the different visions, there is a difference in the quality of healthcare services in both the sectors. So it was during this time I got an opportunity to manage a small private hospital, as well as head a NGO clinic. And where I, besides my managerial skills, besides my clinical skills, I had to also use my managerial skills. And I felt that no, I can make few changes to improve patient experience. So I put forward to the management few suggestions. Sometimes they were considered and were well appreciated, whereas sometimes they were not welcomed, because at that point of time, during those times, patient care or patient centric care was evolving. It was not that much focused. So the higher management, they didn't want to put so much funds in that area. So my efforts were short-lived, because after this I had to take a sabbatical due to my personal difficulties. So as my daughter was growing and she completed her 12th, I thought to again dive back into my career. And lots had changed when I came back, and when I thought of again reviving my career. A lot had changed in terms of healthcare, in terms of technology, in terms of treatment policies. So I had to start from scratch. So I started working in small hospitals, moved on to working in government hospitals, and then to corporate hospitals, sometimes as resident, sometimes as consultant. So, this journey moving on and starting from scratch. When I started working in government hospitals, so while working in government hospitals, after many years, I found it very fulfilling, because it gave me the satisfaction of helping those who were actually in need. And even there was a lot of transition or development in the government sectors. They had improved a lot, and their reach has widened because of the opening of a large number of PHCs, wellness centers, mobile clinics, etc. The technology and the services in the government sector have improved a lot, had improved by that time. And I mean, although funds are allocated, um, but it takes time to process the funds for any program. There are, what I would say, like to say, is that there are multiple approvals required. There is bureaucracy, there is red tape, and sometimes even what is being approved is not able to being materialized, due to which the gaps are still existing in the form of overworked people or undermanned systems, I would say. No, it was during this time I also got an opportunity to work in a research project for preterm birth. And no, it was a hands-on experience where I could experience how the research projects are being implemented in the government settings, and how the people are being enrolled, how the consents are being taken for the research process, because it's not so easy when you carry out research to find solution for a larger contingent of people. So no, all these opportunities made me think, and I think all these things impact you when you are a professional and they are related to your area of work. So, no, each experience um, was impacting me in some or the other way, which I could not feel totally at that point of time. But later on, when I will share what going to share just now, it impacted me. So I was working in government hospital, and then I wanted to explore for better opportunities, for new opportunities and work-life balance in the private sector. So I moved from government to the private sector in private corporate organizations to a level where I got an opportunity to work in one of the top hospitals of India, and where I could see the difference between the private and the public sector. Uh, the private organizations, I mean, what you say, the upgraded technology, better fund allocation, then skilled doctors, or research methodologies, latest research methodologies, and the innovations. They All these factors which I saw in the private organizations or the corporate organizations make them a far apart, make them a high quality medical setup, which not only attracts 1% of the population, but as also, which also attracts the or boost medical tourism from outside. So, India has reached to that level where we the skill of the doctors or the high technology or the new innovations has attracted medical tourism from all over the world. So, although it is a high quality healthcare setup, the private organizations or the bestest of the organizations, but every organization has some or the other gaps. It Whether it is a public sector or it is a government sector, and everything is not equal. So, and that is not equal in private sector because of the diversified services which they provide. So, because of the diversified services, what you say, they provide funds to the department which brings in the revenue. For example, we see that there is a rise in the cancer all over the world. Cancer is increasing, patients of cancer are increasing. So, more funds are allocated to the department which deal with different type of cancer in terms of marketing, in terms of research, in terms of promotion, because it is high, or you say it is very high paying disease in terms of diagnostics, in terms of therapies, and due to which the other departments of the hospitals sometimes get neglected or get understaffed, and they work on sale targets. So, no, somewhere, everywhere, whether it is a public sector or whether it is a government sector, there are pluses and minuses. And both the sectors, they cater to different or diverse type of people. The only thing is to maintain the quality, how you maintain the quality. And I mean, it can be only through managing things, from a very initial level. And when we see that for managing things, you have to go in the administration. So, no, over a period of time, I realized that due to certain government policies, I didn't see growth in my career in the clinical side. So, I tried to switch it in the administrative side. And because I wanted to understand and I wanted to bring that change, I enrolled myself in MBA healthcare. So I did my, and that's how I did my MBA healthcare from IIHMR Delhi. And parallelly working and doing my MBA. So while I was doing my MBA, I was also working in the hospital and was making a smooth transition towards the administrative department, which I was able to make. And I worked in the medical administration and hospital operations. So during this time when I was in the administration, I got an opportunity to work for the JCI and the NABH accreditation, which most of the hospitals now require. So they are quality accreditations of the hospitals. If they are bigger hospitals, they require JCI accreditation, and if it is a hospital which is only a national level, they require NABH. And I think all over the world, there are different accreditations according to the country, and they have to be accredited for quality parameters and for the safety of the patient. So I got an opportunity to work for this accreditation, and during this period of accreditation, I helped the organization in making the managerial and the clinical indicators of the quality, as well as improve the processes in different departments. So, no, although we think that they are big organizations and there will be less gaps, but gaps do exist everywhere, and in big organizations also, they require continuous monitoring, and gaps exist in there can be documentation gaps, there can be gaps in some billing processes, there can be gaps related to, I would say, mm, that waiting time, if it is for the patients, that the waiting time is more, the turnaround time is more. So all these things have to be improved to make quality care or effective care for the patients. So I was able to do this. And besides this, in my day-to-day working, I got the opportunity to collect the data and to analyze the data of the different department. It was during that time when I was analyzing the data, I found out that when I was analyzing the data and I was seeing the diseases, I felt that no, it is not just limited to one hospital or one department. It is more than that. And no, I would say it is what we do in research and policy making, where we want that no, we educate the people about the disease so that no, we are able to eradicate it, or we are able to minimize the effect of all such factors. So, no, this kept on entering all these things which were happening from the time I started my practice to working in government, working for NGOs, or working in the private hospitals. Though every impact, everything which I saw, whether as a professional or whether as a patient myself or as a caregiver to my parents when they were admitted in the hospital. So everything left an impact. And this is how I moved to this thing, kept on in my heart. And I discussed with my mentor after his counseling, after discussing with my peers. I enrolled myself for PhD healthcare and took this topic of uh, self-management of diabetes in elderly. So during my MBA, I had my dissertation on role of hospitals in geriatric care. So it was during that time when I was, so we were asked that, no, what will be the topic of your dissertation, or which is the area you would like to work? So I had given three topics, and my mentor told me, so I want you to work. I had taken up this topic of geriatric care. And I said that, no, when I research and when I read about this topic, I see that, no, very less work has been done, and it is a very less touched area. The world is not yet prepared for geriatric care, but the innovations and the new treatment procedures um, have what you say have been able to combat the diseases, and we have been able to increase the life expectancy. And due to that, there is a rise in the aging population. So we should be well prepared to tackle there, because age also brings their own problem. Besides the comorbidities or the diseases which exist in people, which will rise with age, but age itself has certain problems, which are geriatric syndromes. So, no, at that point of time, I thought that, no, this is a topic which requires attention globally as well as in India. And whether care providers, I mean the doctors, as well as the paramedical staff, is not yet prepared, and there should be trainings. And that's why I took that topic of role of hospitals in geriatric care. And of course, diabetic is a global concern as at the moment, and India being a diabetic capital with 14% of the elderly population suffering from type 2 diabetes. Um, and to be very honest, diabetes, people know, or maybe they know or don't know, but most of them might be aware that diabetes doesn't have a cure. It is a it is a lifelong disease, and it has to be self-managed more by them, by the person who is having diabetes, than by the doctor. And the components of self-management are quite a few, but awareness about those components is very, very necessary. And because as we age, the complications of, if the diabetes is not managed properly, the complications increase, leading to decrease in the quality of life, and also early mortality, morbidity. So my focus is to find out through my research and help people with diabetes for a better quality of life, and to know about the facilitators and the barriers and the facilitators of self-management of diabetes, so that we are able to find solutions which will help people or patients with diabetes to live a better quality of life. And no, we are also on a global level to decrease the early mortality out of this disease. So this is my journey in terms of professional. And during this journey, I had my own personal ups and downs. But yes, each and every up and down uh, with faith showed me a path where I reached where I wanted to reach. Because when I was very young, I always looked up to Mother Teresa. And if somebody would ask me, they would say that, no, I would say I want to become Mother Teresa. But then I realized that, no, it is not what usual is. But yes, I can become a person who adds value to people's life. So um, I follow Buddhism, which is the Lotus Sutra. If you have heard about Namyo Horenge Kyo, and in that, Ikeda Sensei, who propagated the Lotus Sutra, he says that one day of life is more valuable than any other materialistic pleasure. So, no, life is the most valuable thing a person has. And So healthcare is a platform where we can make people aware about the value of life through different programs, whether it is nutrition, whether it is exercise, whether it is what are the risk factors. And I mean, no better way if you have become a doctor to educate people to help them lead a healthy, beautiful, happy life. So that's my journey is, and I enjoy doing it.
Wow, really, it is just amazing. I mean, wow. I am so impressed. It's unbelievable. It's not a journey, it's like an adventure. To learn Russian, to go to another country at that age, no language, no food, no culture. Wow, it is quite unbelievable achievement set. And then, at this age to do a PhD,
Yeah.
that is, people are scared of doing a PhD when they are young because it is inevitably full of difficulties. We all know that. And to say, look, I am a doctor, I have an MBA, but I'm not qualified enough. I need to do a PhD. That is simply unbelievable. It is one of the most amazing journeys that I've heard. That look, people don't do PhDs at this age. They don't because they are so well set in their life, or they are so confident of what they are doing. That say, look, I know enough, I can do. But you are not ready to say that. You're ready to say, let me learn some more, let me contribute some more. So all I can say is, wow, thank you so much for doing it. And of course, it's a very valuable asset that you are creating for the country. You can see things in a different perspective than anybody else because most people don't have this perspective of India, Russia, small hospitals, small towns, big towns. It's a very powerful mix of corporate life, NGO life, academia, PhD, MBA. So all I can say in one word is wow. And it is
Thank
just
you, thank you,
so
thank you.
so impressive that you have done it. So that's all I can say at this time. That it's very, very impressive, and I'm glad that you are here to tell people all about it, and you are still going to make a big impact, I'm sure, because in the end, diabetes, as you said, is self-management. Right? It's one of the few lifelong diseases that once you get the hang of it, then the doctor's role is minimal compared to everything else. I mean, at my age, I know about problems of aging. So, you have to have a rule among your friends that you can't talk about your medical issues for more than 5 minutes. Because otherwise the list is long. So we know all about this, and you try to differentiate between the others, and if whatever other things you have, they need a doctor's input or a surgeon or a doctor or constant monitoring. You cannot control, yes, you can do some exercise and all for your heart, but there are issues in the heart which really need a doctor. And there are issues in the lungs everywhere. It's only in this diabetes which is not really organ specific. Right? But you can, as you rightly pointed out, I also, I told you I have diabetes. So self-management is the key. And 99% of the people who have diabetes have not been told that. And the doctors try not to give control to the patient. Many of the doctors, they try to keep the control with themselves. And what I find is that, as you said, there is no cure, but there are quacks everywhere saying, I'll teach you how to reverse it. Now, they don't tell you what the meaning of the word reverse is. Reverse to me it means you take a car, put it in reverse, you go back. But anyway, that you can't reverse it. There's no cure. But I feel that because the doctors don't share the information, power, and responsibility with the patients, then the patients turn to quacks, okay, who will essentially say the same thing that the doctor should say, that is, you can manage it with diet and exercise, and then they are charging money.
I mean, the patient should be empowered.
Yes,
I would say that the patient should be empowered. That yes, first for the acceptance that they have diabetes. Secondly, they should be empowered so that they are able to take their treatment diligently.
yeah,
Third is to empower them that no, if taken care, you can lead a healthy and a beautiful life.
right,
So, because this is not being shared with the patient, the fear of diabetes or the fear of the disease, patients sometimes don't do things which they can do to improve or to lead a healthy and good quality of life. So I think the diabetes self-management includes the diabetes education. And if that knowledge is shared, the attitude towards the treatment becomes more responsible. And no, there are behavior changes due to which, because the attitude changes, the behavior changes. And if the behavior changes, definitely the disease can be controlled. And because the disease can be controlled, so a person can be leading a happy, stable, healthy life.
thank you so
So,
much for such an optimistic conclusion to this, that took you had such a wonderful journey, and now you are ready to teach India how to manage it. Thank you
thank you.
so much
Thank
for
you.
this, and let's end it here today. I
Yeah.
want to talk to you a little bit offline, and so
Okay.
I have only 5 minutes before the next person. So let's end it here today. I'll talk to
Yeah.
you offline, and then we'll see where to take your journey forward. So
Thank
thank you
you.
very much, Dr. Manisha, for being here. It was really, as I said, a wow to hear what you have said. And I'll be back with another young person or an expert soon. Bye till then. Bye, everybody.
Bye.